So my name's Keir. I'm the Programme Director for Mental Health, LD and Autism across West Yorkshire. So we thought it'd be easier doing it kind of that way. And I know that we've got a couple of colleagues, at least kind of Kirklees and potentially Leeds colleagues, to do a little bit of an update about some of the work in our places. So I just thought I'd set with a bit of kind of context for everyone. So across West Yorkshire, our kind of operating model as a system is based around kind of the primacy of each of our places. So kind of each of our 5 places in West Yorkshire being the most significant unit of stuff. And our West Yorkshire system is the kind of the coordinating bit that tries to help share learning, or to kind of do stuff once, where it kind of makes sense to do stuff once. But actually each of our 5 places is the kind of the main unit. So just as a bit of context, so from a point of view of kind of the wider community mental health transformation agenda, so across West Yorkshire we do some coordination and bringing together, and we also do some do once stuff. So a lot of the work that we do is about trying to share some of the good practice that happens in either Leeds, Bradford, Caldervale, Kirklees, or Wakefield, but we are doing some do once stuff around things like, well, what does an outcomes framework look like? What are we doing around things like information governance when we know there's kind of common barriers? How do we create sensible, consistent job descriptions for peer support workers so they're not different in each of our places? And it's similar when we look at the work that Jess leads around our kind of suicide prevention agenda as well. So the real focus that we've had from a suicide prevention point of view is how do we get as much money as we can to our places locally, so they can discharge kind of what is needed to support local suicide prevention initiatives. But then some of the do want stuff we've been looking at is things like, well, what does real-time surveillance need to look like? How can that work? How do we focus on some of those potentially underserved communities who impact on each of our places, but maybe there isn't necessarily the volume in a single place to really invest? So things like the Gypsy and Traveller community as well. So that's just a bit of kind of context stuff, really. So I think what is really useful about today is really useful hearing your kind of your earlier presentation. I'm sure it is for kind of clinical and professional colleagues as well, is how do we make sure that we share what's going on in each of our places regarding self-harm from a West Yorkshire point of view, where we can, and that's why it's great to hear from Becky and colleagues from Kirklees as a starter today. And then the question we've kind of got is what is the focus for each of our places and needs to stay there, versus what actually potentially could we do once and support as a system more widely? And that might be nothing, or it might be some things, or it might be a lot of things. And that's kind of the journey, I guess, that we're on to the community mental health transformation stuff. So that's kind of my intro and summary, really, other than to say kind of thank you to Jess and other colleagues for getting us to this position where we're able to engage with you guys about the work that you're doing nationally as well. But I hope that makes some sense before I bring Becky in.
It does, really helpful from a kind of conceptual point of view as well, because we're very conscious that a lot within areas there's a lot of kind of different services and fragmentation, and sometimes that coordination function could be coordination and harnessing were the terms that I used yesterday. That might be the thing that really makes this. So Jess, I don't know if you wanted to go next.
Yeah, I suppose just adding to that, from a suicide prevention point of view, I'm the ICS suicide prevention lead, as Keir's mentioned. We've just agreed a new 5-year strategy, and it's brilliant to get your presentation now, because so much of the stuff that you mentioned forms an element of that strategy. So some of the key themes are unemployment, primary care, info, evidence sharing, and crisis. So that would be the kind of stuff that we've agreed to look at collaboratively, the do one stuff. So there is the opportunity there to do some more work on this, as you would expect from a suicide prevention strategy. And I think it's just worth saying as well that we've got some brilliant voluntary sector colleagues on the call. So from Battle Scars, and I know Yvonne's here from Norfolk Hall as well. And so wouldn't it be amazing? So they are primarily, my understanding is, peer support organisations who do brilliant work and are not sustainably funded from any statutory source. So wouldn't it be brilliant to get some sort of immediate referral into peer support from primary care colleagues to sort of look at some of that prevention stuff? And so these are the kinds of things that I'm hoping to explore as time goes on. But in terms of a presentation as to what's going on with self-harm in West Yorkshire, I don't think there's one person within our system who's qualified or has the knowledge to do that. So it would be brilliant to hand over to Kirklees colleagues potentially next, who I know have put something together. And I'm not sure if there's colleagues from Leeds or elsewhere on the call who've done a slide as well. I'm not sure the answer to that question. So that all makes sense.
Yeah, it does. That's really helpful, and particular kind of welcome to. You can't really tell, can you? if we were in person, I'll be looking at Yvonne and waving and Em. I'm looking at you now on your screen. So particular welcome to you. So Kirklees, who's here from Kirklees?
Yes, hi Nav. It's Rebecca at
Oh,
Kirklees.
hi, Rebecca. So I was looking around for you on the screen. There you are in the corner. So Rebecca, do you want to tell us about Kirklees?
Yep, so I'm here with Yvonne from Northaw Hall. So we're here from Kirklees. I'm a public health manager at Kirklees Council, so I oversee the suicide prevention work for Kirklees. We do have a few slides that I've sent to Debbie, and I wondered whether she'd be able to just pop them up on the screen for me, because Zoom is not my one that I'm familiar with. Thank you so much, Debbie. So we will do this quickly, because I'm aware that you're wanting to go to break, Nav, but we volunteered to put a few slides together.
That's ever so helpful, thank you.
So next slide, please, Debbie. So yeah, this is just what we're going to quickly whiz through today. So a bit of a local context. What do we have in place already? What have we done recently on the self-harm agenda? And what would we like some help with? So next slide, please. So we've just lifted this. This is our Kirklees Suicide and Self-Harm Prevention Action Plan. So for those of you that don't know, Kirklees covers Huddersfield and Dewsbury areas in the main, and we kind of split them down into North Kirklees and South Kirklees, because they're very distinct and quite different areas with quite different demographics. So this is our action plan, and these are the 6 high-level work streams that we cover within Kirklees. So next slide, please. So what I've done is just lift from that action plan some of our bits of information that are most relevant to self-harm. So that the main outcome measure that we have is to have a reduction in the rate of intentional self-harm in Kirklees. And then the 2 bullet points underneath are some of our more specific actions that we've been looking at over the last sort of couple of years. So really wanting to take a preventative approach to self-harm awareness, encourage conversations to reduce myths and stigma around self-harm with all stakeholders that work with young people, and also to promote the self-harm prevention resources that we've recently developed for young people and adults as part of the support package offered by Northaw Hall. We're really lucky to have Northaw Hall in our area. I go to Yvonne all the time with questions, and they do fantastic work. But something that I'm really conscious about is that they're very much young people focused, although they do work with parents as well. So I think something that we're wanting to look at going forward is more around our work with adults and self-harm. Next slide, please. So I've just lifted this from our most recent suicide audit, which was covering the years 2016 to 2018 inclusive, so a 3-year period. Particularly looking at the graph on the right, I appreciate it's very small and you might not be able to make it out in here, but basically what this is telling us is that over a quarter of suicides in our area were preceded by self-harm, and half were preceded by a suicide attempt as well. So very much touching on some of the information that you've just gone through in your presentation, Nav, around this being a significant risk factor for suicide. And although there's not a causal relationship there is a relationship of some sort that we need to be able to look at this data and think, right, what can we do to really work with people who are self-harming, because we know that it's a really key opportunity to intervene and prevent further suicides. Next slide, please. So I've just lifted these next 2 slides. You'll be familiar with these from the Public Health England, or OHID, referring to it now, fingertips tool. So this is emergency hospital admissions for intentional self-harm in Kirklees. So this is, I think, all age. So that what this is showing is that there is no significant change in this trend. And if you can see there, it's slightly below the England rate as well. But if we look at the next slide, this is the hospital admissions as a result of self-harm for 10 to 24-year-olds in Kirklees. And the trend here is showing a trend that's getting worse. So it's really important that we not just look at the rate across all ages, but we look at it in specific age cohorts to be able to determine where the need is greatest. Next slide, please. So I'll just quickly pass over to Yvonne to touch upon some of these bullet points.
So some of the work that we've been doing within Kirklees is very much about that early intervention and prevention, as Becky said, and raising awareness really, just so that people can start having conversations around self-harm. So we do have some things. Obviously, we are a children's charity, so we have a focus on the child aspect around and young people aspect around self-harm, but also do a lot of work with adults around young people as well to raise that awareness. So we use things like COOF, which is an online counselling service. We do have a single point of contact for anyone who's got a concern in relation to self-harm. This MHST within Kirklees, which is a mental health in school team, so that's very much about raising awareness around mental health concerns within schools among staff as well, and looking at training around adults around their understanding of self-harm and helpful responses. So as part of the training offer, we do train, we have an introduction to self-harm session that can be for any adults that are working with children and young people, parents and carers that have come across self-harm, and then also for young people themselves. So it does cover quite a broad cohort around self-harm and helpful responses. So those are some things that we've been doing. And next slide, please. Okay, so one of the things that we've been doing is we've done a campaign around Let's Talk About Self-Harm. So there's some resources that have been developed in line with children and young people. There's some guidance for adults and there's some guidance for children and young people themselves. So it's a small leaflet that provides some quick advice and information around self-harm, and we've been running that campaign for about a year now, just to try and get people talking a little bit. Obviously it can be quite a difficult subject, and a subject where there's quite a lot of stigma attached to it, so trying to promote positive conversations around self-harm.
Thanks, Yvonne. Do you want me to carry on, Yvonne, at this point?
Yeah, go on and pass back to you.
Thank you. So in particular, what do we need support with going forward? So I think you've touched upon some of this already, Nav, and your slides will be really helpful for us in this journey. But I think there's something that we need to do about understanding the journey of someone who attends at A&E in Kirklees with intentional self-harm. And something that Yvonne and I are really keen on looking at is developing an up-to-date self-harm pathway, a really integrated pathway that involves partners with primary care, secondary care, voluntary community sector, that brings in all the resources that we've got locally as well. So that's something on our to-do list that we'd really appreciate support with. We'd like to learn from other areas about community-based support outside of hospital and models of care that are available across the country, not just for children and young people. And we'd really like to strengthen our links to acute trusts to work with us on this. So learning from the acute end, you know, who is presenting at A&E, so that we can really use that information to better inform preventative actions in communities. And I think that's the end, Debbie.
Super. That's brilliant, actually, Rebecca and Yvonne. We love a good PowerPoint. So that's great, and thank you for doing those slides. That's really helped us, and will really help me kind of steer the discussion as well. Em, do you want to start? If you wanted to kind of talk about other areas in West Yorkshire.
Yeah, I'm from Battle Scars, which is a charity that supports people who self-harm. But the kind of special thing about us is that we are peer support, so that literally everybody who is involved in working with the service users has either personal experience of self-harm, which is where I come in, or they are like family or carers of people who self-harm. Like I was sort of hearing some things then that were really interesting. We actually don't aim to stop people self-harming. Our goal is just to support them to try and keep themselves safe, unless like their goal may be to stop, and then we will support them with that, but that's not what Battle Scars is about. Our Battle Scars virtual groups only came about as a result of COVID and lockdown, and we now offer about 10 or 11 groups each fortnight. We have kind of standard groups, then we have groups of people who maybe self-harm less or are just dealing with the thoughts. so they're a little bit more gentle than the standard groups. We also have What's Bothering Me groups, which run without topics. People just get to bring whatever they're struggling with and get support and maybe hear some shared experiences of other people. And we also run social groups as well to try and encourage people to interact within our community.
Yeah, and that's really helpful. It's good. So over the past 20 or 30 years, one of the things, I'm a psychiatrist. I've worked in hospital services. I do. Ideally, my ideal treatment outcome is for people to stop self-harm. But, we're very conscious of what patients and service users tell us about the functions of self-harm for them, and how, in some cases it prevents even worse outcomes for them. But I suppose our, if you like, overarching treatment goal is, self-harm's always a symptom of some kind of distress, and it's about helping people. I think that's the important thing. It's not about getting too I know sometimes, in the past, people have got quite cross with me for suggesting we need to kind of, reduce or stop self-harm. But really, this program is about helping people, and I think, organisations like yours and others, the emphasis might be slightly different, but we're all kind of focused on the same thing, which is, just trying to help people. And for me, one of the big opportunities here is when people do present to services, to make sure they get a good deal, because too often, I think in the past, we haven't done as well as we might in services. So we've really got to kind of pull our socks up, I think, a little bit there. Jamie Pick. Sorry, you're on mute. Yeah.
Yeah, I'm here. Sorry, I'll try and be brief. I'm conscious of the time. I suppose, I'm sure, like everywhere, there's all kinds of bits of work happening in Leeds which are related. I don't think we've got an overarching self-harm plan. So the work stems from the suicide prevention plan. But to give a few examples, the personality disorder service in Leeds has shifted its emphasis to working with 18 to 25-year-olds and developing more accessible DPD provision within the community to support that. Our ALP service, which is the hospital liaison service, has been involved with the Fresh Start pilot, the Fresh Start research project, which is about testing out psychological interventions in people who have presented with self-harm. We've recently opened a crisis house in partnership with the third sector organisation, which is a 10-bedded unit which offers a safe space for people to go to. So I suppose there are lots of things that happen that stem from the plan. I suppose my reflection, listening to what you've spoken about, is of the fragmented nature of the system and the organisation. There's loads of good work, and we're really lucky in Leeds with the third sector, with the third sector support and services that are out there. But I couldn't honestly say we've got a really coherent offer for I guess, to support people who present with self-harm.
Thanks, Jamie. That's fantastic. And I think, one of the things that's becoming very apparent to me, more so in this wave than the earlier wave, is just actually, when people are writing down what they're doing, it's already almost a kind of coherent plan. And part of the function of these meetings seems to be putting people in different large areas in touch with each other, because sometimes people won't have heard of the brilliant work that's going on in their area. So I'll bring Jamie in, and I don't know if Donna, you wanted to come in as well. Donna, did you want to come in? I'll let Jamie in first, and then Donna, and then we'll break for tea. Jamie Scott.
Yeah, I mean, you'd be amazed at the amount of problems we have in every meeting just by simply being called the same phone name. Me and Jamie. But yeah, I'm not going to add too much to that. I'm just going to pop something in the chat, actually. It'd be really useful to hear a bit more about some Kirklees colleagues' experience. I think I echo that point from Jamie, really, that what we're probably lacking on is a coherent self-harm level strategy and approach across the city, and hearing what's happening in other place-based areas across the region would be really useful. And equally, we were keen to share some of so we're really trying to focus on where there are gaps. So some of the priorities you mentioned, like younger adults, like transition points, the space between traditional primary and secondary care, part of the transform community mental health services agenda. We are trying to attend to some of those within Leeds, and so we're piloting at the moment and adapted, as Jamie said, DBT program specifically for young adults at the primary care space with primary care colleagues. So again, be happy to share that across across the ICS in terms of some of that shared learning approach, which I think is probably the challenge over the next year or so.
Brilliant. Yeah, no, thanks for that. Donna?
Oh, hi everyone, I'm Donna Hanson. I'm the team manager for the Acute Liaison Service in Leeds, and we're the team that are recruiting patients into the Fresh Start programme. So it's people who present in the ED that have self-harmed. The team do our self-harm assessment. We refer them to the recruitment team, which is LYPFT's Research and Development at Leeds University. They then contact the service users for eligibility and suitability, and then they're randomised into one of the therapies, talking therapies, so CBT and psychodynamic therapy. Several of them, it's not a separate service. This is something that my team are doing within our own service. So several of the staff volunteered to do the training, got trained up in CBT and psychodynamic, and they're doing that alongside their own role. We had a pilot in 2020 to 2021 that worked really, really well. It was only for 6 months. So this full programme is running for 18 months, and we've just recruited our first person into the trial. So the team will be delivering follow-up therapy for 12 sessions with a possibility of 2 booster sessions as well, with the hope that that reduces the self-harm and the presentation in the ED.
Donna, that's really helpful. A real reminder that, you know, I know there's a lot going on in Leeds. I actually worked in your liaison service 3 decades ago.
Right.
So, there you go. So it's nice to hear from you.
Thank you.
I mean, I know in Leeds you've got Fresh Start, you've got Safe Pit as well going, which is trial-based interventions. And for me, you know, that as a researcher and clinician, that's really important. It's the importance of research. But actually, you've got a real opportunity there, which is about using the research to kind of improve the kind of service provision, and then hopefully, when the research works, you know, embedding it within the service. So. Yeah. You know, I'm really looking forward to hearing about that. But that's again, you know, we've talked a little bit, you know, colleagues in Leeds saying, oh, it's great that colleagues from Kirklees have presented, but actually, you know, all colleagues in Kirklees and across West Yorkshire might not know about all the research activity that's going on in Leeds. So it's very helpful to know.